never fails.
We'll be getting started here in just a moment, everyone. We're just letting everyone get into the webinar room.
I'm going to give it about another 30 seconds. Well, let's go ahead and get started, everyone. Let me start off by saying welcome to all of our attendees. We're really grateful you guys are here to listen to what we have to say. This is the Cannabis Administration and Opportunity Act response webinar presented by Focus, Foundation of Cannabis Unified Standards, and AFDO, the Association of Food and Drug Officials. Next slide, please. Let me start off with giving you guys a little bit of background on us. So AFDO and Focus both represent the gold standard in their individual sectors. AFDO in food, drugs, and the manufacturing of all downstream products, and Focus in the quality, health, and safety of cannabis and cannabis products. Collectively, AFDO and Focus serve as the core point between all industries cannabis touches, and as such are uniquely positioned to offer in-depth assessments of this proposed bill and provide solutions needed to enact effective and comprehensive federal legislation of cannabis. Focus and AFDO have already completed a large portion of this effort by working in tandem to determine the operational, quality, and safety standards for the federal regulation of cannabis. Next slide, please. So let me start off by introducing myself and this panelist and speakers on today's webinar. My name is Brett Puffenbarger, and I'm the Sales and Marketing Director for Focus. And let me introduce our founder and president, Leslie Engelking, our vice president and certification director, Aaron Kennedy, and the executive director of AFDO, Stephen Mandernock. I'll go ahead and let each one of them go in order and introduce themselves and give a couple of sentences about themselves and why we're doing this. Go ahead, Leslie.
Thank you. And thanks everybody for joining us. We're really excited to be starting this conversation and looking forward to working with you all to make some progress here. I'm Leslie Engelking. I'm the founder of Focus. My background is in mental health and public health. And then I spent 13 years with Eli Lilly and Company. My entry into the cannabis industry was as a licensed medical cannabis business owner in the state of Arizona. We were the first in Phoenix, and through that experience, I recognized the need for quality and safety standards to help guide this process and left to start Focus as a cannabis health and safety organization.
Thank you, Leslie. Go ahead, Aaron.
Hi, I'm Aaron Kennedy. As Brett said, I'm the Vice President and Certification Director for Focus. My background comes from highly regulated industries like aerospace defense and telecommunications, and I entered the cannabis space in early 2014 as a regulator in Oregon, helping to build the medical marijuana dispensary program, and then left to do consulting to help operators with compliance and operational efficiency. And I ran a large extraction company as their director of compliance and operations for about a year before joining Focus.
And I'm Steve Mondernock, and I'm the executive director here at AFDO. I spent 9 years running the food safety regulatory program in Iowa prior to joining AFDO, where I've been for 3 years. I'm an attorney by trade, and during my career in state government, I spent time serving as a legislative liaison, working with the state legislature, also doing a little bit of federal work, and also developing regulations. So a lot of experience in the regulatory context. Well, let's go ahead and continue, Brett.
Thank you, ladies and gentlemen. Go ahead and go to the next slide, please. So let's start out with a little bit of landscape and background. Currently, there are 37 states, 4 territories, and the District of Columbia who are actively participating in medical, which we're going to call therapeutic versions of cannabis legalization. And then there's an additional 18 states, 2 territories, and the District of Columbia who also have adult use frameworks in place. A lot of what we're looking at today is the draft bill that is the Cannabis Administration and Opportunity Act. And what that is a really good starting point to begin the conversation around cannabis legalization on the federal level. And I'll go ahead and turn it over to Steve, who I know has a couple of different talking points that he wants to hit on this particular area.
So one of the things for those of you that are not familiar with the lawmaking process is a bill like this is an opportunity to begin the conversation and really start the process. And just because let's just say that something like this gets enacted, that doesn't mean it's an immediate effectiveness. There's a period of time that it takes to actually build the regulatory context associated with the program and get to that legalization step. So when I say that, it's a little more complex. We'll give you some examples. From the time the first food safety bill was proposed at the federal level to the time it was enacted, don't be scared, was 26 years. I'm not joking. Sometimes it takes that long to work its way through the process and help socialize within Congress. The other piece, though, is after a bill is adopted, and if we'll use the Food Safety Modernization Act as an example, it was signed into law in 2011, January 1st. It took about 9 years to develop all the accompanying regulations. In addition, some complicating things, if you create a second, another agency or commission or those sorts of things, that only adds more time to the process because it'll take 6 months to a year to get that up and running. And if there's any appointees, that can add even more time to the process because it won't really be able to form until the appointees are in place and confirmed, if confirmation is required. So those are just some challenges. We don't want you to think that, even if a bill does pass, it's not immediate and it's going to take a fair amount of time after that. And there'll be lots of opportunity for input even throughout that process. Let's go ahead and move on.
Well, let's go ahead and let Leslie have a moment
Oh,
to add a couple of talking points on this slide.
Yeah, no, Steve, that's terrific. And your expertise and experience with all this is definitely part of the reason that we're so grateful to partner with AFTO and all the experience that you guys bring. I guess on the whole, not scaring people things, I want to just say that our intent is not for this to take 26 years. We're the efforts between AFTO and Focus that we are launching with this webinar today and will be continuing over the next couple of years are designed to help the federal government get where they need to be quickly. Part of the reason for pointing out the landscape and how extensive the market is for cannabis in the US already is to show that all this is happening without this federal oversight. So when we're talking about CAOA and we're looking at the response, we really need to understand that there's these existing state programs that have therapeutic or adult use, but there's different pathways and different things that need to also be considered. We can't just look at what's going on today. We need to look at where things are going in the future and how those pathways are different and have different needs as well.
Erin, is there anything you'd like to add on this slide before we keep it moving?
No, that sort of sums it up. I think one of the things to consider though, so I guess yes, I said no, yes, is that all these states that have programs are going to be dramatically affected by federal legalization. So we're going to have sort of a car crash situation. We have to sort of be prepared for that. So the federal government will come in and it will be a very slow process. Meanwhile, the states are going to want to keep going at their pace. So it's just something we need to keep in mind as we tackle the landscape ahead.
And actually, that's one other thing that we should talk about, depending on how the law is written and the way this current law is written, it's complementing a co-regulatory system where there's concurrent jurisdiction at both the federal and state level, which we'll just tell you is complex when you have those dual sorts of laws out there.
Great. Let's go ahead and move to the next slide. So I think maybe, Leslie, you want to go first on this one?
Sure. I think the point that we were trying to make in our response to the senators and this proposed bill is really that while we're so grateful for their efforts and starting this conversation that is long overdue, that in general, the overall feel and intent of CAOA seem to really be asking the wrong questions. And what I mean by that is we've taken a look at CAOA and all the different aspects, and it's very clear that what the pathways that they were looking to, existing pathways that they were looking to are based on tobacco and alcohol, which are very relevant and important, but completely neglect any of the health benefits that cannabis can provide. It also completely neglects any of the industrial benefits. And obviously, given our our sustainability challenges and things like that, we really need to think about each of those areas. But more importantly than each of those areas is to make sure that we have to come from a place of health and safety, right? The intent of the government is to protect our people and the interests of our citizens. And we've got consumer protection laws and everything else. And so to focus, when we read this, that was a big glaring missing portion, is there really wasn't a lot of emphasis on health and safety. And that needs to be the first priority, obviously.
Well, and to all of our food safety colleagues out there, I'm sure you can relate, particularly when you look at the alcoholic beverages area, how oftentimes those communities are not really regulated for the safety of their product. And I know some of you have dealt with the leather additives and things like that simply are not a safe alternative to put into any sort of food or drink. But those sorts of things just give you some examples of when you have an agency that doesn't have some level of understanding of the safety and the public health safety of a product. So I think this is a great opportunity to have those, have one of those discussions.
Erin, is there anything you'd like to tack onto this?
Nothing that isn't coming up in future slides.
Perfect.
So I'm going to wait.
So let me go ahead and sum up this and make sure I understood what we were saying in this one. It seems like the Cannabis Administration Opportunity Act was a really good starting point, but it may have looked at it a little too simply. And what we're proposing here is that we need a little bit larger, more holistic and understanding approach, that cannabis doesn't fit one framework. It fits multiple frameworks on multiple levels in multiple ways. Is that a pretty safe assumption?
Absolutely.
Well,
Great.
and if you think about it in the context of other products, right? Look at corn. What if we only used corn for food and we ignored all the benefits that it has for fuel and other things, right? So cannabis is the same. It's unfortunately a little bit more complicated to think about it this way, but it's critically important to do that from the get-go, because otherwise we're going to miss out on all the potential benefits, both health, economic, and otherwise, that are there.
Thank you. So let's go ahead and go to the next slide. So the proposed framework here is pretty all-encompassing, and I think I'll let Leslie, you go ahead and take the first crack at it, and then we'll go to Erin, and then Steve, you can bring us home on this one.
So yeah, I mean, this slide is basically just looking at a very high level model of our proposed framework for the federal legalization of cannabis and the different pathways that it would take. So the first column being therapeutic and adult use. If you can think about this as these are the state programs that are already in existence. So it's the psychotropic use of cannabis, high THC. We have the CPG and the food and beverage, or the non-psychotropic, which requires a completely different pathway and has different needs based on the CPG industry versus a state program. We have the industrial, which is pretty straightforward. And then we obviously have the pharmaceutical. And the part of the reason that we've divided them into these pathways is because if you're looking at what we're calling medical programs in the states, but the only reason that they're medical is because they've been deemed so. There's no actual attributes to medicine like there is in any other kind of medication category. So we need to clean some of that up. We also need to have an expert agency for each different pathway so that people have one place to go and those agencies can work together to make sure that they're making decisions in tandem. And the rest is just kind of showing through those pathways where the products would go, and different examples of how they would be used.
Absolutely. Leslie, I would just like to add, there are other contexts in the federal government where you have this sort of regulation that goes across multiple agencies, where you essentially create a coordinating or working committee that works across products. in the food world, it's working with the Food Safety Inspection Service and FDA and CDC. They all do those sort of cross-functional work together, whether it's in products or illnesses. So that might give you an idea of how something like that might work. It's not unusual. You think of all of you at your state levels, you're already doing this. If you're in a state program working with, the folks responsible for alcoholic beverages, you're often working with the folks responsible for pesticides and various other things as part of your food program. No different than that, you can create that sort of coordinating relationship across all of the entities involved in the regulation.
Yeah.
I think one of the biggest points that we're making here is that while we need this coordinated agency, the product itself, we tend at the state level and in society to treat like a unicorn, but it's not a unicorn. We have existing pathways for the vast majority of the ways that this product is being used and can be used. So the point is, let's not treat it like a unicorn. Let's acknowledge the differences, the idiosyncrasies of cannabis itself, but let's not try to recreate the wheel. Let's use the infrastructure we have. Let's not make it harder than it needs to be. Let's just acknowledge what it is. And then I think that's a much more efficient way forward to use existing health and safety protocols and frameworks. And it's a lot faster than 26 years, did you say, Steve?
Absolutely. Well, the other nice thing is the regulatory context is really set in 3 of the 4 lines. And so you have largely the regulatory context already built, so you don't lose a lot of time building a new regulatory context. You may have to make some modifications, but it's a whole lot easier to modify than it is to build, for example, the new agency, which is the most complex thing to do and the thing that would take the longest. I can recall several years ago, I was working in a field, we established a new federal agency, and literally it took a year to get them to get a payroll code and an office space to start their functions. And if you have congressional appointments now, that can take even longer, or those that require confirmation, that can take years to get people appointed. Which can limit your ability to even start an agency. So those are some of the challenges that are absolutely faced out there. So,
and if I can just add one more thing, I think I just would like to point out that this proposed framework is the high level view of this, right?
Mm-hmm.
But the work that AFTO and Focus are undertaking over the next few years, and hopefully with the help of everybody here and more stakeholders as well, is to try and flesh this out. So what do we need for each pathway? What are the stakeholders that are involved with each pathway that need to help us make these decisions? What decisions need to be made? All of these things. So I guess the point I'm trying to make is just that this is our proposed framework. It will likely be, it will definitely be fleshed out and grow, and it might change. We're not going to make all those decisions on our own. The point of this entire effort is to make sure that we are building consensus around this and taking into consideration the needs of all the different pathways, all the different stakeholder groups that are impacted by this, and do something built on health and safety that actually works for everybody.
Absolutely. Yeah, Leslie.
Thank you. All right, let's go ahead and go to the next slide. So this next slide is about decriminalization, which I think arguably is probably the most important first step to get anywhere down this path. And why don't you go ahead and take it on the first part of it, Steve, and get us started on this one, since you're the expert in the mainstream world of things.
Oh my God, those are words that have never been used with me before. So
I'm here to please.
Excellent. So I mean, actually, this is the easiest part, because essentially you're modifying an existing regulatory structure, essentially under DAA. So that part is easy. The challenge becomes, once you do it, what else happens? Of course, as we already know, United States is kind of unique in the worldwide community, and truthfully in the States now, with the over 37 states and more moving in the direction of legalization, and frankly moving to recreational programs from those therapeutic programs, which is a kind of a consistent move that we've seen across the country. At some point, you know, the question isn't whether it's been decriminalized or legal, it's when is the federal government going to recognize it's been decriminalized or legal? And that's really kind of where we're at today.
I think it's important to point out too that there is some urgency to this, whether it's being recognized at the federal level or not. Anybody that works within this space that has any experience internationally at all will understand that the rest of the world is moving much quicker than the US, right? And I'm not talking about Canada and legalizing through, you know, a federal court decision. I'm talking about countries enacting legislation because they want to do this. They see the economic benefit. They'd like to give back to some of the communities that have been hurt. And so as the world grows around this and the US stays behind, we're losing ground. And most countries in the world would prefer to follow American standards and regulations, but we don't have any for them to follow. And so the implications of not doing this now for the US are going to be felt for decades and decades to come. We can't afford to continue to go this slow and let everybody else get ahead of us if we really are truly going to believe this is an economic benefit and a health benefit to our country. Those are decreasing the longer we take getting involved at the federal level and working towards solutions.
Aaron, do you have anything you want to add to this one?
No, I think that was really well said. I just want to reiterate that the urgency is really the big takeaway here. The damage is continuing to be done.
Great point. All right, let's go ahead and go to the next slide. Definitions. So Leslie, why don't you go ahead and take this one, since I know this one's close to your heart.
I will. Steve, I know you have to go soon. Do you want to say anything before you leave?
I'm good.
Okay.
Yep.
Thank you so much for joining us for this first half, and we look forward to doing the next one with you.
Absolutely.
So yeah, definitions, and I alluded to this earlier in a comment, but we've got a real problem in this industry, in the US especially, because every state definitions are different and there's no common nomenclature. And without that, we can't create meaningful regulation, meaningful policy, meaningful standards. They are the baseline or the foundation for all of this. And it comes up frequently in our work at Focus because we do so much internationally. If you look at what the rest of the world calls medical cannabis, it's not these high THC products that we see in our medical cannabis markets in the state. And that's why I think it's important to really think about this as different pathways and different nomenclature. And the first and primary thing has to be, what are we talking about? Do we all know that what the words we're using mean the same thing? And so that will be one of the biggest efforts I think we start with, is to really get stakeholder involvement and agree on a nomenclature for the big things, but also the little things, right? We lack definition in so many things, which is why we see these big conflicts in the regulations.
Mm-hmm. Just the definitions that the legislatures in the states set, it's different. What an extract means in one state is different than what it means in another state. Maybe it means concentrate over here. And so that can become very confusing to a consumer when they're going to different states. They don't know what they're getting. The labeling requirements are different in what they have to call things on the label. We have universal symbols, but they're universal to a state. They're not really universal. So just getting some sort of standardization of the nomenclature, like Leslie said, so that consumers know what to expect. Everybody knows what to expect is really, really important, not just in the US, but just internationally.
I think I'm going to double down on this one a little bit and say, isn't the purpose of language to be understood? And if we're not communicating in the same way, in the same fashion, and understanding each other, then we're not really using language the way we're supposed to. And I think it becomes even more important when we start talking about the legal aspects of things. And just my 2 cents on there. Do you guys have anything else you want to add on this slide?
Absolutely, the legal aspect of things, but also just think about trade, right? I mean, and contracts and all of that. Like, if we're building a global industry, we've got to be able to be talking about the same things to do trade, right? That's the reason for standards in the first place. So this is such a critical part and most often overlooked. I think.
Great. Let's go ahead and move to the next slide. So this one's on recognition of state laws. Leslie, you want to take us off on this one?
Sure. I'm sure everyone on this call is very aware of the prominence of cannabis across the US now, and Brett kind of shared some stats with us about that earlier. We can't go backwards, right? And the industry's been saying for ages, we're past the tipping point, the cat's out of the bag, that sort of thing, and completely agree with that. What needs to happen, though, for this to move forward at the federal level is that some basic health and safety standards at the federal level need to be set, along with the nomenclature and everything, so that we're all talking about the same thing, we're all working under the same parameters. And then we need some additional standards for products that are either going to be for import or export or to cross state lines, so that trade can happen and the other things. We can't go back and take these state programs away, nor do we want to, or is that the intent? Really, we just want to make sure that we can recognize the state programs, keep them and the patients and customers that they're serving, but find a way to bring this into the federal level too. Erin, do you have something to add to that?
I was going to say, I think this is where she was talking about the train wreck happening.
Yeah.
So
Yeah,
she's
it
got
is.
something.
Yeah, we're trying, the federal government is sort of like this big house. We've got a foundation for a lot of things, like, like Leslie's analogy of corn and things like that. With cannabis, we essentially have all the states like trying to build their own condo, but the condominium building like doesn't even have the foundation poured. So it's like they're all over the place, and we have to not tear down what the states have done while building the foundation for health and safety nationally and internationally. And that's going to be really difficult, but it's going to be really important to the success of the industry, for trade, for the states to be able to support their programs and do it in a way that is easily followed, regulated, enforced, and it just makes it so that like testing standards, for example, are the same throughout the states. That should not be something that is set at the state level. We should have something that says, hey, this is our basic health and safety test for these things. And states can add to them, right? States can always add more to the federal level, but they can't do anything less. So that's basically what we're saying is like pour the foundation, make it solid, and then build on that.
Great. Thanks. I think that's a really good point. Let's go ahead and move to the next slide. Anti-diversion provisions. I think this is one of those ones that's at the very top of the mind for a lot of regulators as they're looking at different frameworks, whether it's at the state level or the federal level. And I think arguably at the federal level, it's going to be incredibly important for us as we mature as an industry and look to become a real functioning industry like the rest of the world. So Leslie, you want to go ahead and talk about this subject just a little bit?
Yeah, for sure. And it is, you're right. I mean, the anti-diversion considerations were coming out of all these decades of this stigma around cannabis, that's fear that has been built in to both the regulatory community and the public. And so these are things that we're going to continue to see in regulation for quite some time until this gets more normalized. And they're important, right? We need to make sure that we're being responsible as an industry, that diversion is not happening, that these products are not falling into the hands of people they're not supposed to. And I think the point here is that we actually need to understand how diversion happens. So we see, obviously, the banking issue in the US is huge, and it creates tons of risks for these industries. When we look at banking operations, what they do is go in and look at financial data, but it's really in the operational day-to-day activities is where the diversion occurs. So this photo is just showing that there's different ways that loss and diversion could occur. And anytime there's a potential for loss, is there a potential for theft or diversion, right? Because there's no standard amount of deviation that we know. So I feel like the important part is we need to be monitoring and measuring inputs and outputs, and we need to have a standardized way for doing that so that we can give people the comfort that they need to move forward with this, but also not over-regulate to the point where it's prohibiting businesses from being successful.
Right. Overregulation actually leads to more diversion.
Yes.
It disincentivizes participation in the legalized market and incentivizes the illicit market. It kind of harkens back to the decriminalization. If we decriminalize it, that takes away that illicit market in a way. There's still going to be some illicit market. There's an illicit market for handbags and watches, right? There's always going to be an illicit market for everything. But what we need to do is mitigate as much as we can, acknowledge the opportunities that people have to divert. And like Leslie said, don't overregulate. Make the regulations so that operators can follow them and understand them. If you do that, then they're enforceable. If they're not enforceable, then you have problems on all sides. So there's a lot of opportunity right now and incentive to divert. And that's what we really need to address, is the root cause is why people are doing it, and then take away that incentive.
I think that's a
Absolutely.
really great point. Yeah.
Yeah, and I think the state programs are such a good example of that, right? And not picking on any state or anybody that was involved with those rules, but we've come a long way in the last decade with cannabis in the US. And so gradually ideas and norms and stigmas are changing, and we'll see that. But we want to make sure that while we're controlling for these things, that's not the primary goal, right? The primary goal is to regulate this in a way that we're incentivizing operators to participate and customers and consumers to participate in the regulated market instead. I mean, California, I feel like, is a perfect example of that. We've created dozens of agencies and how many different licenses it takes to get a product to market, and then it's still super overpriced and taxed. So we've just got to, again, the overall message here is we've got to think about this from the beginning and plan for all these things that are happening so that they don't continue to happen.
I think that's a really great point. Thank you very much. Let's go ahead and move to the next slide. Age and quantity restrictions. I think everybody knows this is a hotly debated topic within the industry, and I think it's something that's going to be very important moving forward with federal legalization. I'll leave it up to you guys. Who wants to take a crack at this one first?
Aaron, you want to go? You want me to?
No, I think you should start this one.
Okay, yeah, it is funny. I mean, I kind of chuckle when I think about it too, and we could actually add potency restrictions in there as well. It was interesting to me that this was even included in the CAOA proposed language, and this is one of the questions that they specifically asked for feedback on. It goes right back to our decriminalization and pathways thing. How are we going to determine a retail sales age? For what? Is that for buying industrial products? Is that for buying over-the-counter medicines in a dispensary? Is it for buying a food product with CBD in it? It's a little premature to start thinking about these things before we have these pathways, because each pathway has a different need. And I think the other part of that is we desperately need a single source for reporting on all these things, right? So until we actually understand what people need, whether that's patients that may or may not need a higher or lower dose, or it's consumers that want this, we have to look at the data and make good decisions based on that. But we can't do that until we sort of segment and prioritize pathways.
Mm-hmm. We can sort of ballpark things, but like you said, without that data, then we're sort of shooting in the dark. With all the states have different like potency levels and sales limits right now. The age limits are pretty consistent, but the potency and quantities do vary by state. They seem pretty arbitrary. They're not really based on any data or science. And so until we get there, we're kind of just still shooting in the dark.
And it's, yeah, Aaron, and thank you for saying that they're not based on science. So again, I feel like a lot of the restrictions that we see around quantities and potencies and age are related to the stigma and fear around cannabis. And you look at potency levels across the country, and it's like the biggest deal, and everybody's so concerned about cannabis getting higher potency, yet we don't prioritize looking at terpenes at all from a health and safety perspective. That's a, if you want to pay the extra to do it kind of thing. And we know terpenes are one of the biggest contributors to potency. So again, this understanding of what we're trying to regulate, how it's impacted, it needs to be thought through in a very meaningful way.
Yeah, I think one other thing that might be worth touching on is that in the therapeutic aspect of things, it's not just an adult product, right? And I'm not saying by any means kids should be smoking weed. I don't think anybody's throwing that out there, but I think it is important to realize that while we're talking about the frameworks, there has to be a way to not also hurt sick children when we're looking at it.
Yeah, patients are kind of agnostic to age. It could be, yeah, super young to super old.
Yep. And that's where I think too, like, especially as medicine, that's where the pharmaceutical pathway has to be different than the therapeutic pathway, right? As adults, we're comfortable making decisions about natural health care. I mean, statistically, I think, I can't remember the exact number, but it's somewhere around 50, I think it's 58% of patients of people surveyed said they prefer to use a natural option like cannabis over a traditional pharmaceutical. We should have the right to do that. People have the right to do that through state programs. That needs to be continued, but we also need to diversify and say, okay, but how do we serve the medical needs of patients like these children and not eliminate them from the entire program?
Great point. All right, let's go ahead and move to the next slide. Evaluation of societal impact. I think let's just start with legalization of cannabis at a federal level is going to have massive societal impact. And I will go ahead and kick it over to you guys. Leslie, you want to start with this one?
Of course, happy to. So social equity in the United States, as it relates to cannabis, has clearly been a flop across the board. More states have lawsuits and ongoing litigation around it than do not, that have tried to implement a policy like this. So we clearly need a better way to do it. But I think it's important to also understand that if you're looking at the effect of the drug war on people, that's much more related to this therapeutic or psychotropic use of cannabis than it is a CPG or an industrial or a pharmaceutical. And so these are issues, again, that can be much easier solved through the separation of pathways, because we can address this. This is kind of a different part of this, but I think it's important to state that we have to look at social equity different and the societal impact of this differently than what we have been in the United States. It needs a more holistic approach. We see this come out even in the sense of, farmers, the producers growing all the product are not financially rewarded like the manufacturers are, right? There's the opportunities and things are different. And we need to help that. I mean, the intent of the Farm Bill for legalizing hemp was to give farmers an opportunity to have another economically beneficial crop and sort of get back in the market. And so it's important that we look at all the different impacts, not just specific to drug war, but specific to legalization too.
Yeah, the impacts that legalizing will have can't really be understated, because we have these farmers, we have entire communities that suffer because of the illegality of this product right now. And people have been operating, growing cannabis, producing the products from it for generations, not as long as some other countries, but for a very long time in parts of the United States. And they make a very good living doing what they're doing. And we have to acknowledge that in order for them to come into the legal market, we have to provide support for those communities that are otherwise supported by methods we wouldn't otherwise agree with. So by supporting the farmers, by supporting the people in these communities, we're actually making the entire community, whether or not they're involved in cannabis, is moot. That entire town, entire part of a state will be benefited by legalizing and supporting the system that we build.
Sure.
I think that's a really great point. Is there anything else to add on this slide? Nope. Great. Let's go ahead and move to the next one. Conducting research. I think everybody knows that's one of the very first things we hear in the industry. Why isn't there more research? Why isn't there more research? And I think something that comes with federal legalization is the ability to do that research. And why don't you guys go ahead and take it off and run with it? Leslie, you want to get this one started?
Yeah, I have a couple points on this one. One, and part of the reason the United Nations symbol is there is again, the world is changing around cannabis, whether or not the US is. So it's important that in the United States, we don't just look at data derived in this country around cannabis, that we are recognizing these studies that have been done around the world. In medicine, that is a very familiar thing. In my background in pharma, it's you don't put any less priority on something in the Lancet that you would in the American Journal here. So it's important that we recognize that. I think the bigger priority as far as these efforts go to build a roadmap for federal legalization is we need to determine what research is necessary, right? So where are the exact gaps and what are the types of studies? And if we could look at that collectively and figure that out, it would minimize the time to get the data that we need, right? It could drive everything. And I feel like right now we have a lot of companies that are spending a lot of money to try and get FDA attention or approval and doing studies, but the studies are driven about their individual products. And so and there will always be a product study. That's not the point. But the point is we need to look at why are we looking at this? What is the data that is needed to change minds and convince people of safety, and then prioritize those studies collectively.
Right, and looking at what is existing in the market and studying the effects of those things as well. The vape crisis was huge. We didn't have any research done on any of the products that were on the market, any of the ingredients that were going into the products. So prioritizing those things rather than the might be, could be sort of things, those are important too. Maybe cannabis can help with fill in the blank, but we also have to prioritize the things that are on the market now that people are consuming. What is it doing to them? What are these ingredients doing? We know that they're generally accepted as safe, but are they safe when combusted and inhaled? Probably not. So we need to study those things. We need to study the effects on the brain at different ages. There was a question about that that I noticed in the chat. So that's an important point, is, you know, that will help set the age limits for therapeutic. For pharmaceutical, that's a thing with the doctor. It's a relationship there. But, you know, we can't really move too far ahead without this research. And Leslie makes a great point that we can't do it by ourselves. A lot of countries are way further ahead on this. And so we have to embrace the international community here.
I think one thing I'd like to add just to this conversation is we're slowly recognizing, and some people more quickly than others, obviously in the US, the harms of the war on drugs, right? And that there are potential benefits from plant medicine. And we're seeing it in the psychotropics, you know, with mushrooms and everything else. So some of the research that I believe needs to be done is looking at all the policies that came from the Controlled Substances Act, right? We look back now and, you know, with our 2020 hindsight and say, okay, this wasn't driven by any motive to protect the health and safety of citizens. It was directed by political motives. And now we've had this law that's impacted all these people for all these decades. Marijuana can't be the only substance that's like that, right? We're already now seeing it with the psychedelics. So what else do we need to look at? And is there a reason to go back and look at all the Controlled Substances Act and say, are we limiting the potential benefits from these plant medicines or other substances because we've got this fear-based policy or politically based policy rather than a policy designed to protect the health and safety of Americans?
Mm-hmm. Yeah, I think that's a really good point. Go back, look at them all, ask, why do we have it? Do we need it? And then go from there. Maybe a lot of them can be scrapped.
Yeah, or just
Based-
updated to make it easier, right? Why are we, okay, we don't know enough to necessarily move forward and regulate, but why do we have it in such a tight little box that we can't even study it?
Mhm.
You know, it just prohibits progress.
Right.
Great points. All right, let's move on to the next slide. Everyone's favorite topic,
Mine.
taxes. Don't we all love
Literally.
talking about these?
Mhm.
I'll go ahead and kick it over to you guys and let one of you take it off and run with it.
I think that the thing that the draft bill sort of focused on, and what a lot of states really focus on, is taxes. And you know, like we've been saying over and over and over again in this webinar, that's the wrong thing to focus on. It should be health and safety first. Taxes, of course, are going to be a part of this, but you know, at the risk of sounding like a broken record, if you overtax, you're incentivizing the illicit market again. So, you know, I know Leslie has a lot of thoughts on this too, but because we talk about this all the time. But you know, you look at states like Washington that has what, like a 37% tax, California and its insane taxes. They have, there are people going, I'm not going to participate in this because I don't want to deal with this tax structure. And if we don't have something that is reasonable, that is common sense, that we can justify, then we're sort of shooting ourselves in the foot in the long run.
For sure. This is such a, it's a subject that I don't even like to talk about because it's so hairy and messy, but it's critically important. And I think one of our challenges with the CAOA proposed bill was we didn't do a financial analysis in depth on it, but even just in looking at high level what they were proposing, those numbers would effectively just send everybody to the black market. I know there were some other submissions and comments done by different groups of economists. We're very much looking forward to building a stakeholder group and steering committee to actually look at what is the right amount of tax, what can the market afford, how can it be borne. If you talk to an economist, they will always tell you that the reason to regulate an unregulated market is to control it. That has to be your first priority. Taxes and the financial benefits are secondary and will only come properly if you actually regulate properly. So we're going about it a little bit backwards in the states, especially after the pandemic and everything else, because people and states need this economic development. That's okay. But if we're going to make a federal plan, we need to think this through. It can't be willy-nilly. We have to understand the impact, and we have to make sure that every decision that we make is driving a regulated industry and not further illicit activity, which is what we feel this would have done. I mean, the state programs provide like irrefutable evidence that this is problematic already, right? I mean, we see them, each state kind of going back and forth and still having issues with this. So it's a not fun subject, but it's one that with data, I think can be addressed and with the right stakeholders and all of that.
Thank you. Great. All right, let's go ahead and move on to the next slide. I believe this is our last content slide. So operational rules and regulations for cannabis manufacturing. I know that's something that we hold very close to our heart at Focus, and I will let you guys take it away.
I can start this one. The operational rules and regulations are the crux of this, right? And they need to be based on standards so that the standards can be updated every year, but the regulation doesn't change every month. It's critically important, not only for product safety, but for the safety of the people working in these operations, for the neighborhoods and communities where these facilities are, for the general public. And so this is one of the areas that has been most overlooked in state programs. So the regulations typically have been designed to control for all the scary factors around cannabis, whether it's diversion, packaging, age restrictions, quantity restrictions, any of that kind of thing. And it's not, the safety happens on the day-to-day activities and what's going on in there. And the product safety comes from making sure that those activities are well controlled and documented. And it's just a big gap that we've seen in state programs. Instead, what we see is testing as the priority, and testing is critical. So to be clear, that the conversation here is not we have too much testing or we shouldn't have testing. It's we need to make sure that if an operator takes their product to be tested and it comes back wrong, or what they wouldn't see or didn't expect to see, or they didn't pass, that they have the documentation to go back and look at, first of all, is this a problem within our operations, or could it be a problem at the lab, right? So that they have that defensibility of their own products and processes, but also that if there is something wrong operationally, that they're learning from a bad test result. And, we read tons of media articles every day about tests, bad testing, lab shopping, all these, lack of consistency in labeling, but we don't actually go back and go, well, why are they happening? Why is that happening? And that's what we need to understand. And that all happens through the operational activities.
And at a state level, I think the states don't really understand that. And they don't really have comprehensive regulations to drive that. Further, a lot of the manufacturing has been really glossed over. The requirements of like a volatile solvent extractor, for example, they have very specific building requirements in order to ensure the health and safety of their employees and of the people around them. And the states sort of play catch up there. I've seen that there are states that say, well, as long as you meet zoning requirements, but they don't do anything to address fire code or, any other regulations that might apply. And they sort of go, well, it's cannabis. We don't really know what to do. It goes back to the whole, it's not a unicorn thing. They do extraction of essential oils in similar ways. There's no reason that you can't apply the same regulations to that to ensure health and safety. So that's that foundation again, and then the operator has to build to those regulations, to those specifications, meet the health and safety requirements, and then to Leslie's point, build into their operations procedures that it further ensure health and safety through consistency, understanding root cause when something goes wrong, so that from the beginning, from that foundation all the way to the end consumer, you have something that you can really trace and have confidence in.
And that's how we get better as an industry, right? If we're not documenting and tracking and discussing these things, how are we going to know how to improve? And we're still a very new industry, so there's so much competition, and we haven't seen a lot of the things that will just naturally occur over time within the supply chain, just like they do anything else. But if you look at food or ag or supplements or pharmaceutical, all of these industries, because they're federally regulated, have guidelines and standards and operational practices that they are supposed to follow and get audited to those. So cannabis just needs the same thing.
Something I picked up on that wasn't directly said, but I think is really important to say, that I noticed when you guys were talking, is that it's not just patient and consumer safety. It's also employee safety. It's also worker safety. It's a larger issue than just ensuring the standard safe, good products getting in people's hands. It's also ensuring that those of us in the industry are also safe and taken care of, and that things are done in a way that ensures everyone is safe.
Absolutely. I can give you an example of an event that happened in two different places with an extraction, a volatile solvent extractor. In one situation, they essentially got verbal approval from the fire marshal for their extraction space. They didn't really do the work. There was a personal relationship there. And what happened was there was an explosion, and the employee was life-flighted to a hospital because they lived in a rural area. In another situation, there was an equipment failure, sort of a similar situation, but it was a volatile solvent extractor. They had the proper class 1 division 1 room. And when it happened, the employee was safe. Everyone was trained on what to do. And from the time that the equipment failed, releasing solvent into the atmosphere, to the time that the fire department cleared them to go back to work was 27 minutes. And no one was injured and no one was life flighted anywhere. So that's just like opposite ends of the spectrum, right? But you want to always be over here with the company that if something goes wrong, that no one's injured and you can get back to normal operations. Meanwhile, the management team and the crisis team can say, how did this happen? How do we prevent it from happening again? Because even though no one was injured in that situation, you don't want it to be repeated. You never want to be the one that's life-letting your employee to the nearest city for severe burns and life-threatening injuries.
I think, Erin, you make a really good point about training, and it wasn't something that necessarily we were planning on talking about here, but when we're looking at the challenges of the state programs and the sort of bandwagon regulations of each state sort of trying to do a little bit better than the state before, and instead of starting from scratch and trying to do things right, is that we have to train these states. So it's not anybody's fault that the programs came out like this. The states were forced through voter initiatives initially to regulate something they knew nothing about. But here we are a decade later, and we're looking at a much bigger scope of what we're trying to do globally with cannabis. So training the folks that are going to oversee this on what they're looking at will be super important too. It will make it so much easier for industry as well as regulatory, because we don't have any consistency. An auditor from the state in one state looks at one thing, an auditor from the other state looks at another thing, but even within state, some auditors prioritize things that are not even on checklists. Some just follow the checklist. And the same goes for insurance and risk reduction, risk management principles. Like how are insurance premiums determined if we don't have this baseline, right? And so the baseline is these operational rules and regulations or standards.
Awesome. All right, next slide. So that concludes the information portion of this webinar. And I've just got a couple of final things to add to the list of things to consider as we're closing out here. So next steps are going to be a survey to all of the attendees today is going to be sent out. It's not about the webinar necessarily. It's about our actual response to the Cannabis Administration and Opportunity Act. And what we're really looking to do here is drive the conversation forward. We feel that we put out a very comprehensive response, and probably one of the more comprehensive responses that was given to the senators that put out the Cannabis Administration Opportunity Act, but we don't want to do it alone. We want input from relevant stakeholders. We want to know, one, how we did, we want to know how we can improve it, and we want to understand what other people are looking at. Maybe we missed something, maybe we want to continue adding it on. So after this, we're also going to be sending out a recording of this webinar along with the survey so that anybody who wants to can listen to it again. We're also going to be sending out the full response in written form so that you guys can read our entire response, not just our breakdown of it or our general breakdown of it. And the goal for us is a next webinar on December 6th at 10 a.m. Pacific, 1 p.m. Eastern. So same time, same place. We'll be doing another webinar that is going to include some of this feedback from you guys, the participants in this webinar, and the world at large. Will be sending out some other additional surveys and information about that moving forward. But the going point here is that we're not trying to just talk. We're not trying to just say we're right or this is the thing. We're trying to continue a conversation. We're trying to open up the world to understand where we as an industry, as regulators, as any real interested stakeholder, can continue to have our voices heard as we drive toward federal legalization in the United States and eventually, hopefully, the world. Do you ladies have any closing thoughts or statements you want to add before we get this thing wrapped up?
The only thing I wanted to add was just to give some context to all of that. So just so people have an idea of what's to come and what we're planning. So this first webinar today was designed to simply give information about our response. We're collecting your feedback in the chats. Like Brett said, we'll have surveys. They will go out to all participants, but broader than that, much broader than that as well. Over the next month, we will look through the responses from the survey and put together the webinar for December based on those survey questions. And a lot of what we're going to be talking about is what people have told us, how we're going to do that. The entire emphasis and effort of this is so that beginning next year, we've got a roadmap, we've got pathways, we've got different stakeholder groups and steering committees under each, and that we can really get engaged in building a roadmap for federal legalization. AFTO and Focus have done this based on consensus and community building for years. And we're really, really counting on everybody that's here and anybody else that you know that is a stakeholder that has something to add to get involved. And more information will come in each of the next 2 webinars on how to do that.
Yeah, and I think we're all really excited for the opportunity to participate in this process. This is something that doesn't come up that often, and we really look forward to as much participation from people as possible. We can't do this in a silo, nobody can. So I'm personally really looking forward to seeing what comes out of the survey and how this shapes in the future.
Likewise.
Great. Next slide. Well, that's it, folks. Thank you all for participating. You guys were wonderful in the chat. I loved some of the question and answers we received, and I stand with the ladies up here on the stage with me. We're looking forward to your responses. We're looking forward to your feedback on our feedback, and we're looking forward to continuing this conversation in the months to come as we get closer and closer to federal legalization, maybe truly becoming a thing. Thank you all, and have a great day.
Thanks, Brett.
Thanks, Brett.